So with cases rising, many are wondering when is the right time to get a COVID test. There are no set guidelines right now. News 6's Lauren Cervantes did speak with two doctors who have a difference of opinion.
With a high demand for COVID tests following the holidays, who should be getting tested and when?
Only test if it's going to change your behavior or it's going to change anything you need to do.
Dr. Ali Mokdad of the University of Washington's Institute for Health Metrics and Evaluation has been studying COVID-19 and the spread of the virus. He says unless someone needs to make a decision about traveling, returning to work, or seeing other people, testing should be reserved for those who need it.
If you have severe symptoms, seek medical care. There is no question about that. But if your symptoms are mild, and similar to what you have been experiencing as a cold or a flu before, why seek medical care and why be tested? If you need medical care, you will be tested. If you don't need medical care, save the test for somebody else who needs it.
And Dr. Todd Husty, medical director for the Maitland Fire Department, agrees. But where there's a difference of opinion comes with the time frame of testing.
We can detect it once symptoms do appear.
But Dr. Husty says getting a test on day 3 or 4 may yield more accurate results depending on the type of test.
The home tests especially are notorious for not being accurate early on in COVID. The PCR tests multiply what they find on that swab, multiply it many, many times, and therefore they're more sensitive. But a home test just does what's on the swab. It doesn't multiply it. So if there's not enough there, it's not going to show up. So you'll have a falsely negative test.
But what they both agree on is what they say everyone should do if they have any sign of symptoms.
First thing you do is you self-quarantine, meaning that you hang out by yourself.
For now in Orlando, I'm Lauren Cervantes getting results, News 6.
Advent Health says the positivity rate at Centricare is 40% right now. That is the highest it has been since the pandemic started. The data indicates Omicron has still not quite reached its peak, but doctors say even with so many cases, it will be difficult to get to herd immunity.
Herd immunity is somewhat of a moving target because it may require repeated vaccinations, repeated infections to really get where we are. And then if the virus mutates again, that would put that herd immunity in question.
While most cases of the Omicron variant tend to be mild, Advent Health says the rise in infections is impacting hospital staff. It says many are coming down with COVID. Obviously, they can't work. The health system remains at green status, meaning operations are normal.